Now let's get back to reversing course through discourse. So where to start? I do have a meaty topic here. I want to get to a couple laws recently signed in Texas and Florida that target minority communities, Black communities. But first, I think I want to do a little bit of context to show why they will cause so much harm if it's not painfully obvious when we get to that point, and just how cruel they are when you take everything into context. So uh, I the AP did a series of articles on the treatment of Black Americans in our healthcare system. And it's like a series of like 6 or 7 of them. And I read a bunch of those and I read some other articles on diversity. And I could not help but raise this issue on the pod. So I'm going to jump right in. Apologies if it feels like a shock. It's going to be an abrupt jump in, but I really don't want to ease into it because I feel like that would do a disservice. So let's go. Okay. So Black women in the US are nearly 3 times more likely to die during pregnancy or delivery than any other race. How does this happen? It's actually just a sad, simple answer, because it's totally avoidable. It happens because patient complaints are ignored, straight up ignored. Give me an example of that, you may say, and I'll pull one from the Associated Press article. A Black woman from Alabama was experiencing all the joys and ups and downs of her first pregnancy. She worked for the University of Alabama, which has an affiliated hospital. When she began having debilitating stomach pain, she went to that hospital. It was affiliated with her employer, thinking, hey, that makes sense, right? They should take care of me. However, her pleas for help were shrugged off and she was repeatedly sent home. They were telling her that she was suffering from normal contractions. Even as the pain worsened and she returned, she began vomiting. She was dismissed and offered Tylenol instead of them doing a workup on her. Only when the baby's heart rate plummeted did doctors and nurses take notice. She was rushed for an emergency C-section months before her due date, was put on life support, and nearly died from an undiagnosed case of sepsis. Okay, now, to be fair, maternal sepsis is a leading cause of maternal mortality in America for anyone. And it can be hard to detect early on as it resembles common pregnancy pains. But the inattentive care that Black women experience create a lag in treatment, and that has disastrous consequences. What are those consequences? Black women are twice as likely to develop severe maternal sepsis as compared to their white counterparts, right? So continuing on. Black babies are more likely to die and also far more likely to be born prematurely at nearly 15%, setting the stage for health issues that could follow them throughout their lives. For comparison, white babies born preterm are closer to 9%. Now, what are some of these lifelong health issues? Black Americans experience higher rates of chronic ailments such as asthma, diabetes, blood pressure, Alzheimer's, and recently COVID-19. Black Americans have less access to adequate medical care and have shorter life expectancy. In fact, more than 7 million women of childbearing age live in counties with limited or no access to maternity care. There's a lot of stats in this, but I think it's important to understand because this is going to build up.
Yeah.
So from birth to death, regardless of wealth or social standing, Black Americans are far more likely to get sick and die from common ailments. And over the past 2 decades, the higher mortality rate among Black Americans resulted in 1.6 million deaths, excess deaths, 1.6 million in the last couple decades, 20 years. So Black Americans' health issues have long been blamed on genetics or behavior, when really a number of racist circumstances like redlining and a lack of healthcare access play major roles. And historians even trace racist medical practices to slavery, which is no big surprise. And to fully understand maternal and infant mortality, we need to understand the brief but insightful history of gynecology. I'm not going to go into crazy detail, but it's worth noting. So historian and author Deirdre Cooper Owens said, and I quote, "The history of this particular medical branch, it begins on a slave farm in Alabama. The advancement of gynecology had such an intimate relationship with slavery and was literally built on the wounds of Black women," end quote. So reproductive surgeries that were experimental at the time, like C-sections, were commonly performed on enslaved Black women. And physicians like the once heralded J. Marion Sims, an Alabama doctor many call the father of gynecology, performed torturous surgical experiments on enslaved women in the 1840s without anesthesia. Even after slavery ended, hospitals performed unnecessary hysterectomies on Black women and eugenics programs sterilized them. This created massive multi-generational distrust of doctors within the Black community. Not to mention segregation barred Black families from the well-funded white hospitals up until 1964, and the gap is still felt today. Rana, I think her name is Raina A. Hogarth, an associate professor of history at the University of Illinois, said it well, and I quote, "People need to stop thinking about things like slavery and racism as just these features that happened that are part of the contours of history, and maybe think of them more as foundational and institutions that have been with us every step of the way," end quote, which I just thought made sense, right? So how does it still impact any one of these children born before 1964? Well, other than the stories of distrust being told to new generations, some healthcare providers still hold false beliefs about biological differences between Black and white people, which kind of blew my mind. I mean, I kind of was almost scratching my head at this, but the physicians still believe that Black people are having less sensitive nerve endings, thicker skin, stronger bones, and those beliefs have caused medical providers today to rate Black patients' pain lower and recommend less relief, which just sounds barbaric.
And wild that you could graduate from medical school and believe that, but
right?
A lot of doctors do.
This was disturbing. Like I was reading these things, and this is a summation, and I go check out the description in the pod episode for the full articles, because there's so much more. I didn't want to make this into a 4-hour episode, but there was just so much in here. I was like, oh my God, like this is disturbing. So
a lot of assumptions that still carry through based on the way in which medicine was practiced. And they're taught as facts as opposed to investigated as what they are, which are assumptions. I mean, naturally, if you're going to conduct barbaric surgery on a human being, a good way to live with it is to assume that they just don't feel the same way you do. So if you're going to propagate that as a myth and then it becomes science because no one's fact checking it, then then you end up in a situation like this. I will also say,
you have mentors and they tell stories, and that stuff gets handed down generation after generation, whether it's within a family or among colleagues. Like, think about your own job.
It's also in
go ahead.
I'm just saying it could even. I think it's a little more worse than that. It could actually end up in literature. It could end up in academic literature as sort of
and we've
not commentary, but just sort of
you're right,
underlying ethos behind the science, essentially.
I think we covered this indirectly in a couple other episodes.
I covered
it could have been
it
could have been from AI, and it also could have been some other medical things we were covering, maybe with Onessa.
But it was basically
the idea that these papers are out there. They were published from the day, and they're debunked now, but they're out there. And so when you're doing research and stuff, it's so easy to pull up that stuff. I think even when we were talking about the Supreme Court's ruling on abortion, they were citing stuff from the colonial era.
Correct.
There's just stuff that's publications that are out there across disciplines that aren't mothballed and archived, where it's this is no good anymore. It's there.
Yeah. But if it supports your argument, you're going to use it. I think, and also Sims, for instance, did come up when I think at the very beginning of our pod, it was maybe episode 10, really early. We talked about some of the controversy over statues being taken down. Sims' statue was at Columbia Medical School, so that was the big hubbub over taking his statue down. It was first educating people on exactly what this guy did. He wasn't just the father of gynecology. It was how did he become the father of gynecology? Is it worthwhile to keep this man's statue up simply because he pioneered a particular field, if in that pioneering it was on the back of thousands upon thousands of people who were grievously injured, if not just
those should be the statute,
right?
The learnings came from them.
There you go.
And their sacrifice.
Well, that was an argument. Right? I mean, I do believe they eventually took the statue down, but it was a huge debate. It was I would say back in 2008 or so, something like that, 2009, for that particular statue. Anyway.